Welcome to our discussion on chronic obstructive pulmonary disease, or COPD. This complex lung condition affects many people across the globe, and today we're going to delve into what it means, its causes, symptoms, and tests. However, it's important to note that this video serves an educational purpose and is not a substitute for professional medical advice. Always consult with your healthcare provider when making decisions about your health. With that said, let's dive into our topic. So what exactly is COPD? It's an acronym that stands for Chronic Obstructive Pulmonary Disease. This is a lung disease that makes breathing difficult. For those with COPD, the airways, or the branching tubes that carry air within the lungs, become narrow and often get clogged with mucus. The air sacs can also become damaged, which leads to feelings of breathlessness and fatigue. Now, COPD can be a serious illness. It's not curable and can worsen over time. However, it's important to remember that there are treatments available that can help manage the symptoms. COPD is often referred to by different names such as chronic bronchitis or emphysema. These are types of COPD, and each has unique characteristics. Chronic bronchitis is a condition that we see commonly in people who smoke cigarettes. It can cause scarring in the airways and reduce airflow, making it difficult to breathe. Emphysema, on the other hand, is used to describe damage to the air sacs in the lung. This damage can also restrict airflow and cause breathing difficulties. Then there's asthma, a chronic inflammatory disorder of the airways. With treatment, the inflammation and narrowing of the airways usually reverse. However, in a minority of people with asthma, the chronic inflammation can permanently restrict airflow. When this airway narrowing can't be completely reversed with treatment, the person is said to have COPD. While these terms may sound technical and daunting, understanding them can help us grasp the nature of COPD and how it affects our lungs and breathing. Now that we know what COPD is, let's discuss what causes it. What causes COPD, you may ask? Well, the most common culprit is smoking. The smoke from cigarettes can inflict irreversible damage to the lungs, leading to the narrowing and clogging of the airways that we see in COPD. But it's not just smoking. Exposure to toxic fumes or gases, especially over a prolonged period, can also contribute to the development of this disease. Think about certain work environments where harmful airborne particles might be a regular part of the job. And then there's the rare genetic cause. In some cases, COPD can be the result of a genetic disorder known as alpha-1 antitrypsin deficiency. This particular condition can lead to lung degeneration and ultimately Colorado. PD, a simple blood test, can check for this genetic problem. Now that we know the causes, let's look at the symptoms. It's important to be aware because early detection can make a significant difference in managing this disease. What are the symptoms of COPD? Well, the curious thing about COPD is that it often doesn't cause any symptoms at first. However, as the disease progresses, the signs become more apparent. Shortness of breath, especially during physical activities, is a common symptom. You might also experience wheezing, which is a whistling or squeaking noise as you breathe. Another prevalent sign is a persistent cough, often accompanied by spitting up sputum or mucus. It's worth noting that these symptoms aren't unique to COPD and could indicate other respiratory conditions. But if they persist, it's essential to consult a healthcare provider. Moreover, people with COPD are at an increased risk for other health issues. These can include infections such as pneumonia, lung cancer, and heart problems. So it's not just about managing the symptoms, but also about keeping an eye out for these potential complications. Knowing the symptoms is important, but how do we confirm if someone has COPD? Stay tuned to find out. Is there a test for COPD? You might be wondering. Indeed, there is. Medical professionals typically use a test called spirometry to diagnose COPD. But what exactly is spirometry? Picture this. You take a deep breath in and then blow out as fast and as hard as you can into a tube. A machine connected to this tube then measures how much air you can expel from your lungs and how quickly you can do it. That's spirometry in a nutshell, but that's not the end of it. If the results of your spirometry are not as expected, you will be given a medicine in an inhaler to see if your breathing improves. After a few minutes, the spirometry test is repeated. This step helps differentiate between COPD and other lung problems, such as asthma. Here's a fascinating fact. People with asthma usually see normal results after they use an inhaler, while those with COPD often do not. In some cases, your doctor might order additional tests. These tests can help rule out other potential causes of your symptoms. They can also identify some of the complications that COPD can lead to. For instance, a blood test might be performed to check for certain genetic conditions or to assess your overall health. Now that we understand how COPD is diagnosed, let's wrap up our discussion. We've learned a lot about COPD today. We dove into understanding this lung disease that can make breathing difficult, often characterized by narrow and mucus-clogged airways. We discovered that it's often referred to as chronic bronchitis or emphysema, each having unique effects on our lungs. We also discussed the causes of COPD, with smoking being the most common culprit, along with exposure to toxic fumes or gases. In rare cases, it can be linked to genetic issues. Symptoms, often silent in the early stages, can escalate to shortness of breath, wheezing, and coughing. It's important to be aware that COPD can also increase the risk for infections, lung cancer, and heart problems. We highlighted the crucial role of spirometry in diagnosing COPD, a test that measures how much air you can blow out of your lungs and how fast you can do it. Remember, while COPD is a serious illness, there are treatments that can help. Always consult with your healthcare provider for advice and treatment options. Thank you for watching.